You don't need to have any metal in your mouth at all. Complete metal-free dentistry is possible now, and not every dentist may tell you this, so let me explain why. Metal fillings hopefully are going away, and there are fewer of them. Metal crowns are even not as predictable or expected today. A lot of times people know that we can do full porcelain crowns, but the one holdover in dentistry has been dental implants. The standard of care today is still titanium dental implants, but I'm going to tell you why that isn't in your favor and why there's something much better today. So first of all, I want to tell you about two patients that I had that really woke me up to this idea of problems with titanium dental implants. And these were within a couple of months of each other, which is interesting because I think I was at the place where I was ready to pay attention, and so they both came along. The first was a woman. I actually placed a titanium dental implant on her, and I will always remember it was right down here. She came back after a day or two and she said, "Is this supposed to hurt this much?" And I said, "Well, you just had surgery. It might hurt for a little while." She said, "No, this is doing more than that. This is keeping me up 24/7. It's hurting all the time, and it hurts bad. I'm having to take all kinds of pain medicine and it's still there." I said, "Well, that sounds a little unusual. Let's see if over the next couple of days, if it goes away." Well, she called me over the weekend and she said, "I cannot stand this anymore. I want you to take this out now." So we scheduled her Monday morning. She came in, I took the dental implant out, and she said, "Oh my gosh, that feels so much better." Like within, hours of her just coming undone, she said, "The pain's gone." I don't know what it was, but the pain's gone. And so I looked on the dental x-ray and there's a nerve that passes right down here through the jawbone. And I said, I must have gotten too close to that nerve. That's all I can think of, is that it must have impinged some on that nerve, and that's what the pain was from. I said, "Let's let it heal." So she went a couple of months, let the bone heal in the area. And then I said, "Let's try again. Let's place another one, and I'll keep it very short. Basically, I'll keep it way above that nerve so it won't be a nerve problem." Put the second dental implant in. She called me on the weekend again and she said, "The pain is the same. I need this out now." So came in, took the implant out. Once it was unnumb, she said, "Pain's gone. I really don't want an implant here anymore." It was in an area that was fairly visible and definitely chewed. So I had just started placing zirconia implants, which, if you don't know what zirconia is, it's actually, interestingly enough, if you look at the periodic table, it's right next to titanium on the periodic table. But we use an oxide, so it's zirconium oxide or zirconia instead of zirconia. So it's no longer a metal. It doesn't conduct electricity. It has no other properties that a metal has. So we're going to talk about what those other issues are with metals. But I said, I've started placing these dental implants, and if you're willing to try, I think we should give this a try. It took her a couple months to come around, but she said, "I really am missing this tooth. Let's give it a try." Place the dental implant, no pain. It went just as we typically see with any dental implant placement, no pain, typical recovery, and she's still chewing with that dental implant today, and it's been probably over 10 years since that time. What was the problem? What was happening with her? This really made me scratch my head because it wasn't the implant placement and it wasn't the implant itself. It was the material it was made of. So we're going to get to that in a minute. The second woman that I always will remember is another around this same time. It was on the upper right, very back tooth. Placed the dental implant. She came back about a week later. It wasn't that she was in excruciating pain, but she said it's just inflamed. Like everything's just hot, it's red. And she said the strangest thing, ever since I had that implant placed, I can't wear metal jewelry. And I just thought she was maybe a little crazy. And I said, well, surely it couldn't be related, but that's fascinating. That's interesting. She came back again in a week and she said it's not getting any better. It's red, it's inflamed, it's hot, just a touch out here, it's hot. And she's like, "I can't wear metal jewelry anywhere now since you put this in. I just want you to take it out." So we don't do this routinely where we just put one in and take it out, but her symptoms were such, she said, I'm just done with it, I want it out. So we removed the titanium implant, and obviously heat went away, swelling, any of the redness was gone, but she started wearing jewelry again with no problem. So what I realized with both of these patients is that the procedure itself wasn't the issue. It was the material that this was made of. So I started looking into allergies. I said, is this something that people are allergic to? And I found that actually there are very few true titanium allergies. It's not an allergy. This is a sensitivity, particularly the one with a metal jewelry issue. This was a sensitivity that she was having. Both of them were having a metal sensitivity. Why is there a sensitivity to titanium? Because there's so much of it in our environment today. It's in paints, it's in cosmetics, it's the hard candy coating on Skittles and M&Ms. It's so many different places, titanium oxide. And what bodies are doing is they're becoming sensitive to the metal. So what I found is that these people didn't have an allergy to titanium, they just couldn't stand it anymore. So when we used an alternative, they were fine with the dental implant. So when you have a tooth removed, your options are going to be to do nothing, to do a removable something, so a retainer that comes in and out, to do a bridge, which there are definitely some downfalls to doing a dental bridge, but sometimes that's what people choose, or to do a dental implant. Well, these patients had exhausted all of these options, or sometimes they're not always an option. A bridge is not always an option if it's a very back tooth, which for the woman with the necklace, it was a very back tooth, so she didn't have the option of a bridge. So a dental implant was it if she wanted to have the tooth replaced. The good news is that we don't have to use titanium. We can use zirconia. We can use zirconia implants, and there's some massive benefits with them. Number one is aesthetics. So I actually have a dental implant myself, and it is a titanium implant because it was placed 30 years ago before we had any options. And just recently, one of my kids mentioned, they're like, how come your gum's all gray? I mean, I've had this implant for forever, but they're just old enough now to pay attention. Well, it's because that titanium shows through my gums, and you see a little bit of gray to it. That's the beautiful thing about zirconia implants, is they're white, completely white. So they look like a tooth. They look like a tooth root. There's no metal to block out anywhere. And that's what we often have to do with titanium, is block it out somehow, which makes it difficult to make it look right. So with zirconia, we can make them look beautiful, just like that tooth was born there. Biocompatibility, what is that? Well, that's your body saying, I actually like this material. And there's scores of research showing that zirconia is more biocompatible. Your body likes it better than titanium. What does it look like when it does this? Well, it's not red like this patient was. It's not swollen. It's not hot. It doesn't do any of those things. The body just says, oh, yeah, I like this material. This is something that I will accept. The gums grow to it, which they don't do to titanium. They grow to it. The gums aren't red at all. We don't get pockets or the bone shrinking away. So you actually get more bone preserved around these implants than you do around titanium implants. The other beautiful thing is that it doesn't conduct electricity. Now, this is a big deal in our world today because there's so many electrical currents surrounding us. This is Wi-Fi, this is cellular frequencies. We're surrounded by them. And those frequencies, when they pass through metal, they heat the metal up. Well, when the metal is heated, it actually destroys the bone that surrounds that metal. So we're seeing an exponential loss of dental implants. And believe me, the dental industry has a lot of reasons for it. They're blaming it on cement. They're blaming it on care, that people just aren't taking care of them. They're blaming it on just gum disease in general. There are all sorts of things that they're blaming this loss of bone on. But I think it has a lot to do with the material itself, that's why the bone is just kind of shrinking away from these dental implants. So there's a lot of what's called peri-implantitis, which means gum disease around implants. So if you lost a tooth because of gum disease, it doesn't necessarily just get fixed because you put an implant in, specifically if it's titanium. Zirconia doesn't conduct electricity, so it doesn't have the problem with these frequencies passing through it and heating up the metal. Nothing heats up with zirconia. There's a debate about this still in the dental field, a lot of debate about it, and most dentists are going to tell you that they are going to be placing titanium implants almost exclusively. Well, research is coming strongly from Europe. They are about 10 years ahead of the US, and there's research showing that there are benefits that cannot be gained by titanium that we can get through zirconia. Now, it is a little more difficult to get them established to begin with, so some dentists shy away from this as well. You can put a titanium implant almost anywhere and it will be successful at first. The problem is it's not successful long-term. So find someone that's experienced with this, that knows that titanium is not the only choice that you have, that zirconia is an excellent option. A lot of people will say that it breaks, that it fractures. That was the olden days. The way they used to make these zirconia implants would fracture more frequently. We're not seeing that now today. So zirconia is a fabulous option. They offer a blend of biocompatibility, something your body loves. They are aesthetic, they look beautiful, and they're long term. They're there for the long term, and they're very, very stable in the long term. If you would like to know more about this, please check out our zirconia implant guide and all the information that is there, because you deserve to know what your options are if you're looking to replace a tooth.